As we grow older, particularly after the age of 60, many changes begin to take place within our bodies. Some are expected, like graying hair or reduced energy levels, but others can come as a surprise, especially when they start to interfere with daily life. One of the most common and frustrating challenges faced by older adults is a gradual loss of leg strength. You may notice it when climbing stairs, rising from a chair, or even just going for a short walk. Tasks that were once second nature can begin to feel exhausting or unsteady. But here's the important message. This decline is not just due to aging itself. In many cases, it's connected to specific nutrient deficiencies that can be corrected. Your body still has the ability to repair, strengthen, and stabilize, especially when given the right tools. And 3 vitamins in particular play a powerful role in making that possible: vitamin D, vitamin B12, and vitamin E. Let's talk first about vitamin D, which is arguably one of the most crucial vitamins for seniors. While it's best known for supporting healthy bones by improving calcium absorption, its role in muscle function is equally vital. A deficiency in vitamin D has been closely linked to muscle weakness, poor balance, and even a greater risk of falls. The problem is, as we age, our skin becomes less efficient at synthesizing vitamin D from sunlight, and we often spend less time outdoors. This leads to widespread deficiency, even among seniors who think they're eating well. When vitamin D levels are low, you may start to feel a constant heaviness in your legs, sluggish movement, or cramping, especially after light activity. Restoring optimal vitamin D levels through safe sun exposure, fortified foods like dairy and eggs, or doctor-recommended supplements can have a dramatic impact. It's not uncommon for seniors who begin vitamin D supplementation to report feeling steadier on their feet, more energetic, and even less fearful of falling. It's a simple step with far-reaching benefits. Next, we must discuss vitamin B12, which is essential for nerve health, red blood cell formation, and overall energy levels. What's alarming is that a significant percentage of older adults have low levels of B12 and don't even realize it. Why? Because our bodies become less efficient at absorbing B12 from food over time. Add to that the fact that many common medications, like antacids or diabetes drugs, further reduce B12 absorption. The symptoms of low B12 are subtle at first: tingling in the legs, numbness in the feet, occasional balance issues. But over time, these symptoms can progress, affecting gait, coordination, and even memory. Since the nerves in our legs are responsible for movement, reflexes, and balance, any deficiency that impacts the nervous system will eventually be felt in the legs. Replenishing vitamin B12 can restore nerve function, improve leg coordination, and reduce fatigue. Whether it's through high-quality animal products, fortified cereals, or supplements, getting adequate B12 can be life-changing for someone struggling with leg weakness or instability. Finally, let's talk about vitamin E, which often flies under the radar when we talk about aging and mobility, but it shouldn't. Vitamin E is a powerful antioxidant that protects your cells, including muscle cells, from damage caused by oxidative stress. This is especially important for seniors, as the body naturally experiences more inflammation and slower recovery as it ages. When your leg muscles are inflamed or weakened, even normal activities can leave you feeling sore or drained. Vitamin E supports better circulation, reduces inflammation, and helps muscle tissue recover more efficiently. That means stronger, more responsive legs and less pain after physical activity. It's also been noted that vitamin E can help improve blood flow, ensuring that muscles receive the oxygen and nutrients they need during movement. This makes it an excellent nutrient for seniors who want to remain active and mobile. You can get vitamin E from nuts, seeds, spinach, and avocados, or as a supplement if advised by a healthcare provider. Now, it's important to remember that while these 3 vitamins, D, B12, and E, are powerful allies for strengthening the legs, they're not magic bullets. They must be paired with a healthy lifestyle to produce real and lasting results. That means staying physically active in a safe, regular way, through walking, light stretching, or even chair exercises. It also means staying well hydrated, avoiding processed foods that increase inflammation, and getting proper rest. And yes, consulting with your healthcare provider before starting any new supplement is a must. especially if you have underlying conditions or are on medication. Your health is personal, and it deserves a personalized approach. But the truth remains, your body can still grow stronger even after 60. It still listens to how you treat it. When you give your body the right vitamins, minerals, and attention, you support not just your legs, but your whole system. Strong legs aren't just about walking. They're about independence. They're about getting out of bed confidently, stepping out into the world without fear, and continuing to do the things that bring joy and purpose to your life. Whether it's playing with grandchildren, tending a garden, or simply walking without discomfort, these moments are made possible by taking care of yourself from the inside out. Don't wait for weakness to become a crisis. Start nourishing your legs today. Your future self will thank you for every step you took, literally and figuratively, to prioritize your health. With the right nutrients, smart choices, and a little patience, stronger legs are well within reach. So keep moving forward, keep learning, and never underestimate the power of proper nutrition, especially when it comes to the legs that carry you through life. In conclusion, the journey of aging does not have to be marked by frailty, instability, or constant physical limitations. While it's true that the body undergoes natural changes as we move past our 60s, it's equally true that we retain the power to influence how we age. Weakness in the legs, loss of balance, and reduced mobility are not simply inevitable. They are signs that the body may be asking for support, particularly in the form of essential nutrients it's no longer getting in sufficient amounts. We've taken a deep look at 3 specific vitamins today: vitamin D, vitamin B12, and vitamin E, and how each one uniquely supports leg strength and overall mobility. These aren't trendy supplements or miracle cures. They are well-researched, medically understood nutrients that play real and measurable roles in how our muscles function, how our nerves communicate, and how our cells recover and rebuild. Ensuring that your body gets enough of these vitamins can help turn the tide against progressive leg weakness and help restore confidence in everyday movement. Vitamin D strengthens both bones and muscles, creating the foundation for stable, powerful legs. Vitamin B12 safeguards nerve health, restoring the sharp signals and reflexes necessary for smooth coordination and balance. Vitamin E protects muscle cells from inflammation and oxidative stress, promoting better recovery and long-term endurance. Together, they form a nutritional support system that encourages strength, mobility, and independence, 3 things every senior deserves to maintain. But let's be very clear, vitamins are just one part of the solution. They are a tool, not a replacement for movement or medical care. To truly improve leg strength and stay mobile for years to come, these vitamins should be part of a larger daily practice that includes regular physical activity, a balanced diet, hydration, proper rest, and most importantly, listening to your body. Health is not a one-time achievement, it's a lifelong relationship. And even in your 60s, 70s, or beyond, it's never too late to improve that relationship. Now, before making any changes to your supplement routine, always speak with your doctor or a qualified healthcare professional. They can assess your personal needs, perform any necessary blood work, and guide you toward the most appropriate doses. Personalized care is what makes the biggest difference, especially as your body becomes more sensitive to changes. So, as we close this discussion, remember this aging is not about giving up. It's about leveling up your self-care. The legs that have carried you through decades of life still have strength within them. They simply need your support. With the right vitamins, the right movement, and the right mindset, you can walk into your future stronger, more stable, and more confident than ever. Take this knowledge and apply it not just for yourself, but for those around you who may also benefit. Because every step matters, and so does your health.